Instrument-assisted soft tissue mobilization has shown to be effective in the conservative management of carpal tunnel syndrome. The Graston technique is one such method in which stainless steel instruments specifically designed to contour to different parts of the body are used to first assess and then specifically treat soft tissue dysfunction. With carpal tunnel syndrome, we're going to first scan the soft tissue of the wrist flexors through the forearm and then into the hand, into the palmar fascia, thenar and hypothenar eminences. We're going to start with a concave instrument to first sweep through the wrist flexors looking for adhesions within the soft tissue. Adhesions are identified by texture changes within the tissue. We often may feel a gritty or granular type sensation, identifying such a lesion which may be restricting the soft tissue. Once we locate these adhesions, we can more specifically release these adhesions by using even smaller instruments designed to specifically target the tissue. After working the convex surface of the wrist flexors, we're going to work the concave surface of the palm using a convex instrument. First, scanning the soft tissue, looking for restrictions in the tissue, and then more specifically releasing these adhesions. After working the palmar fascia, we can move to even smaller instruments to more specifically work within the digits, work through the thenar and hypothenar eminences, and then specifically target the flexor retinaculum. Now we're using caution not to apply pressure to the median nerve, but simply address those structures around the carpal tunnel, trying to address those structures that run through the carpal tunnel, as well as the flexor retinaculum around the carpal tunnel. It's theorized by releasing these soft tissue adhesions, we can help take stress off those structures running through the carpal tunnel and possibly even expand the volume of the carpal tunnel, taking pressure off the median nerve. At some point, we may eventually want to work up the kinetic chain. We may need to release the pronator teres, possibly work up into the shoulder and even up into the cervical spine. After our manual portion of the technique, we then incorporate exercise in which we try to elongate the soft tissue which we addressed through stretching. We can incorporate stretching into a home program, as well as incorporating strengthening exercises to address those soft tissue structures which we targeted. This portion of the technique typically lasts about 10 minutes and is typically performed twice a week. Treatments typically take about 3 to 4 weeks or 6 to 8 visits for successful outcomes. The Graston technique can be considered more effective than other traditional approaches, as the stainless steel instruments actually allow you to more specifically identify the soft tissue lesions, as they will amplify what you feel in your hands. Once you identify the lesions, you can much more specifically release those adhesions, as the surface area of these instruments are much smaller than the surface area of the pad of your finger or thumb. Also, this technique has benefits to the patient, as the patient can continue working, as opposed to other forms of more invasive treatment where patients may actually need to take time off work to have surgery. Again, the Graston technique is just one form of instrument-assisted soft tissue mobilization which has been proven effective in the conservative management of carpal tunnel syndrome.